Okay. You go ahead and just describe what you're doing.
Okay. Well, first of all, I mark out approximately where I want my tray, and if I have any question, I ask the doctor to mark it. And that just gives me a good guide as to how far I want to extend my tray, so I have to do a lot of trimming.
So we took an alginate impression,
True.
and we poured it up.
Yes.
Go ahead and show what that model looks like, just head on.
Okay.
I'm sorry, you had it right, just right where you had it.
Over here?
Yeah.
Okay.
Okay.
And I usually, sometimes after you pour it, there'll be these big kind of flashes of stone. I always try to trim that away. I use just a regular burr on the lab hand piece, and that'll just give you more room to work, especially when you get to a lower one.
Okay.
So you have that kind of estimated, and then
So now let's see that where you've marked it with the red.
Okay.
Just kind of hold it right there. I'll zoom in on it.
Okay.
Actually, hold it away. You just need to get it further.
Just a little red line all the way around.
Okay.
If there's a little frenum, I try to incorporate that, trim around it. Then I'll use half a sheet of pink base
see.
plate wax.
Yeah,
No.
okay.
What
You
do
use
I
a
need
half
to
a
do?
sheet.
Half a sheet of pink base plate wax.
Okay.
And I usually warm the water in the microwave because the tap water doesn't seem to get hot enough. But if you get it at the right temperature, it really, really will form well around this. And you don't have to do too much playing around with it. This is pretty warm. And I usually try to press this into about exactly the shape I'm going to do my tray.
Does it matter if the model is wet or dry?
I've never noticed it matters either way. I try to keep it just shy of the line that I drew, and then that way I can see my line, and I can, when I go to trim it again, it'll be easier. So now I'm going to cut it away.
And you're cutting it right at the red line.
Right about at the red line, yeah. Maybe a little shy of the red line. I mean, it doesn't have to be perfect because you can trim your tray, but it makes it a little quicker. You don't have to do as much trimming.
And this pink wax is going to act as your spacer between the model and the triad material.
Correct.
Okay.
Correct. So the next step, you're going to paint your pink wax with the MRA model release agent. This will help you to get the wax out of the tray so it doesn't
So it lubricates basically the wax
Yes.
from the triad material you're about to put on there.
Yes. The tray material is blue, real sticky, so I'm going to use what's left on here on my hands, and that way it'll hopefully not stick too much to my hands.
Kind of like a thick fruit roll-up.
Yeah, it is. I never thought about that. Probably not as tasty. One good thing about this material is that it'll stretch, so if you have like a little bit larger model and you're trying to get it, you can kind of push it and, manipulate it where you want it to be. Because it's sticky, I always put a little bit on the outside also, this helps me to be able to move it around easily, nicely. And if you fold it towards the front, you can get yourself a little handle too.
Some doctors like to have a handle and others don't.
I know. I
think-
never made handles before I got here. I don't know how he ever took them like that. But now I'm going to trim it again. And this time I'm going to trim it the same way, but just this side of the wax. So now I'm approximately right on my line because I trimmed the wax just a little shy. And I don't know if you can see how it looks like it's a little bit short here, but that's why this stuff is kind of soft, and you can kind of push it into the area so that you have it.
Anyway, put it on the countertop and do that so it's more stable.
Okay. Just it'll just kind of keep going a little bit, you know. You push too hard, you could push a hole into it, but just a little encouragement goes a long way with this material. And my handle's flopping, I can see it. Handles are a little tricky because nothing holds them up, so you have to kind of cure in increments and keep teasing it back in place.
Is there a way to do that trimming on the countertop, or do you have to?
Well, probably. I just haven't ever.
So it makes it a more stable.
Yes.
So where there's a front on that little cord of tissue, you're going to
I'm going to
relieve
trim it
that
up and relieve it.
because
yes.
when you go put that in the patient's mouth, you can't be pulling on that
Exactly.
string of tissue.
Mm-hmm. And I know that's approximate. Again, I'll try it back on. I'm going to try it back on my model once it's cured a little bit. This thing about making my handle pretty. No, it doesn't have to be. My first cure is going to be 1 minute.
Okay.
And I'll pop it on.
Hold on a second. Hold on, you're moving too fast for me.
Mr. Cameraman.
Okay.
Okay.
So now we have it in
the triad
oven.
unit.
You're going to set it for 1 minute.
The switch that says table brings the table into either a spinning mode or a still. You don't want it to be still because it'll burn a hole in the material. So the table should be spinning, and cure should be on also, and the on switch over here. One thing about the triad unit is, let's say you're going to make this tray, you started to cure it, but you had to go do something. You don't want to turn that light on, get it real hot, turn it back off and back on again, because they say it'll break the bulb. So you have to give it about 10 minutes with that fan. That fan is cooling it's going to automatically come on when you close the door. Now, because I made that handle, I'm going to sneak in here and make sure that it's not going to cure in a funky position.
So you want to have it come straight out, just like a regular stock tray.
Right. And I don't want it to droop. And it cures, I guess I should say slowly. The only problem with you have to make sure that your the handle isn't going to get like way up too high where it's going to get in the way of their lip. You know, that would be my only concern with having a handle. I think that's pretty good. I think it's staying in the right position now. So I'll cure it for about a minute. And the only reason I do it a minute is because that pink wax under this light gets really hot. The pink wax underneath starts to melt, and you don't want your tray coated with wax because your impression material, even if you have adhesive in there, it's not going to stick. So I only let it go a minute, peel out the wax, and then cure it for another minute. The whole complete curing, I believe, is 7 minutes, but I usually do it in stages. You don't have to do it in stages. I just developed this. And every time you open the door, the timer starts over again. And it is pretty hot. And you'll see how it's...
Put it back on there. I didn't see it separated.
Okay.
So you just took it out of the oven.
Out of the oven. It's pretty hot. You'll see the wax is inside. And just to be sure that it isn't going to stay in there, I'm going to dash it under cold water, but I have to go to the sink.
Okay.
I I just want it to cool down a little.
You ran on just underneath
Just
regular tap water.
Yep, underneath cold water, right?
The purpose of doing that was to
Harden the wax up again so it doesn't stick in the tray. Because that oven is so hot. And then it should just peel out almost in one big sheet. So you have your tray, your basic tray. And now I'll cure for another minute. Just because I don't want to trim it if it's too mushy. It won't trim well.
1 more minute.
So that means it'll be 2 minutes and I've cured, so I don't really have to cure it over 5.
Alright, so we just pause it.
Alright. I trim a little now.
You're just getting the rough edges off?
I'm going to take most of the rough edges off, correct. It's still a little bit soft, a little bit easier to trim. Just trimmed off the rough edges. And I kind of run my finger around because, you can tell if it's going to be sharp for the patient. I'm going to try it back on and see basically if I'm pretty close. I am. I have a couple of areas that I think
How can you tell if you're close?
Well, I'm looking at my red line again.
Let's go and put it on the counter, please.
I'm looking at the red line. And, for instance, I think when I put this down, it looks to me like this little area is another little frame attachment, and I would like to not pinch him there. So I'm going to kind of draw it on there where I think I need to trim. I'm going to go around and look everywhere. Maybe same way over here a little bit. It's probably better to be a little bit short than a little bit long. That way our border mold will pick up, the extra instead of having it impinge and pinch and all that good stuff.
Can that try and be turned off, or is it?
It has to cool for 10 minutes, and then it has to cure another 5.
Okay.
So yeah. So these little spots will be. Now I'll trim those.
Hold on. I'm gonna get you in focus here.
And I just use the red pencil because it's easier for me to see. It back on, you'll see that those areas aren't going to bump like that anymore. Not so sure about this up front. I might need to trim that a little bit more. Looks like could be. But for the most part, that's the tray. And all I need to do now